someone else that we've had on the program before, and who's also leading the charge, one of the digital health leaders in America, particularly around telemedicine and in children's health, is Dr. Krysti. Krysti, thank you. Welcome back. And through Greg Bauer at HITLAB, thank you for jumping back into the program with us today. How are you doing?
Yes, thank you for having me. It's my pleasure. I always have a good time with HITLAB.
Agreed, and just can't imagine what you're in the midst of, given how much telemedicine has been a part of the healthcare system and what's really become now a virtual services routine for so many hospitals and physicians' offices around the country. First of all, just give us an update. How are things going with you and CHOP?
Yes, so for psychiatry and behavioral sciences department, during COVID, we ramped up to 100% telehealth. And as the pandemic got safer, things got safer, we are now a hybrid model, both telehealth and in-person. And with some public health emergency status has been lifted in some states, and it will be continuing to be lifted progressively throughout the nation. We are strategizing how to make the hybrid model be official. So those are some discussion in the works.
That's wonderful. And one of the things that we've seen in the research, a lot of research papers published, especially over the last 6 months, about the administration and the implementation of telemedicine really in the first year of the pandemic, was the importance of support groups and the importance of support groups in virtual settings. Can you tell us a little bit about the implementation of support groups in virtual settings and how that helped not only improve engagement, but also encourage transparency and open communication?
Yes. So from a clinical perspective, there are partial hospitalization program, intensive outpatient hospitalization program, IOP, that use support groups as a way for us treatment. And recently the new CMS have released billing codes and they did approve for group sessions to be reimbursed. And that's a great stride. CHOP and myself contributed to some of the advocacy work in that. And further, just from the general population perspective, there's many support groups out there. The mommy and me support group, the single dad, the substance abuse treatment program that uses support group. And now that everyone is used to the Zoom meetings, they are more inclined to join a virtual support group that is convenient to their function in their life. Like after putting the kids to bed, let's join a support group for depression, that I have, and it's part of the treatment team, the treatment planning. And I think as people are more willing to engage in those support groups, a lot of treatment planning when it comes to therapeutic treatment with your therapist or with your psychiatrist can include support group. I actually run a support group for general population as well as for therapists on a platform called Orchid.exchange. And I did it kind of like as a pilot, to see if people would really be engaged. And I was overwhelmed and surprisingly overwhelmed and glad that it has an uptick in people willing to engage.
That's so impressive. And tell us a little bit more about that. I think I'd like to hear more about how you're utilizing digital health and telemedicine to help kids and adolescents in this kind of way.
So for our partial hospitalization and our intensive outpatient programs, we are using it as part of the treatment. And for the general people population, I think there is a education level of awareness and education that needs to be done for the general population to buy into support groups. So part of my platform and my Instagram is vo.care, is about raising awareness to that option. And to be, from the public health perspective, it's a preventive care, right? When you start getting stressed, join a support group, talk it out with your peers or a qualified therapist. It can be peer-led, or a qualified therapist can be leading these support groups. And it doesn't have to get to the point where you need to see a therapist weekly, or you need to see a psychiatrist even for medication. So I think support group is, in a way, preventive care. And I am a big advocate for it, and I hope that it gets more buy-in. Right now, there still is an awareness level that we need to bypass.
Yeah, and that's so important. And psychiatry and behavioral health, and both sides of the coin, are more important than ever today with the pandemic. And the kind of the Keynesian human spirits shifted from everyone's going out and living a normal life to everyone's got a quarantine. And now we're supposed to just bounce back like a tree flipping up in the wind. And not everyone's doing that. There are definitely a good chunk of society that are like, I'm not sure about getting back out. I'm not sure about doing all that stuff. So, and with kids and adolescents, there is such an exposed population here. How has psych and behavioral health shifted to telehealth to help these populations, again, young children and adolescents, bounce back after the pandemic?
Right. So some of the things that we are doing is for kids, particularly with anxiety. I think there's a gradient level, right? We're definitely, a lot of my patients are pushing back about going in person to see me because of the convenience, as well as like, we're not comfortable going to a hospital setting to see me. And so we are working with them to really have that transition be smoothly, where only the first visit, like if for initial eval, like first time meeting a patient, we're doing in person. Follow-ups we're doing through telehealth. And so that model can be done in other institutions or can be applied to others' clinical model. And I think that is a great way to ease people into in-person visits. But nevertheless, I think there will be a subset of people who just really prefer telehealth out of convenience, and particularly for children. When it comes to telehealth, I can, from a clinical perspective, I can see them in natural setting, right? I can see them where they go, where they do school. I can see when a parent use their rear view camera. Not a lot of people know about this, but there's a front view and a rear view, and you can actually do telehealth by having the parent show their rear view camera, and I can see the kid playing around in the background. So I can see how hyperactive they are. I can direct the family in therapy on what to do with the kid. So there's many therapeutic way where we can have direct impact in the home, helping the parents with the behavior or with the symptoms in the moment.
That's spot on. Yeah, without a doubt. And again, you guys are really, leading the charge here on so many ways. But at the same time, there are a lot of challenges that you're seeing. I know just from the emails we had back and forth prior to the session here, there are some substantial challenges that people are facing here. And to walk us through a little bit about some of the challenges that folks are going to face when they're implementing these sorts of telehealth, psychiatry, and behavioral health technologies.
Yes, one of the biggest challenges is reimbursement. A lot of academic institutions, hospitals, clinics in general are fearful that payers will stop paying for telehealth. And so, anyone listening, call up your insurance, tell them how much, really call up the member services in your back of the insurance, the number in the back of your insurance, and tell them how much you value telehealth, because they do track those complaints and they do track that feedback. And I think it has to be known that the consumer want it, right? The hospital system can definitely say whatever they want to the payers, but it's their members that count. And so that is one thing we're fearful of, is that they won't pay for it anymore. Two is operations. When you're developing a program, a telehealth program, you got to think about the processes and the operation. And so that's something that is beyond the control of a general population. But that is definitely something that I have on my academic and hospital management side of things. But I would say the main challenge is reimbursement. We're not sure whether a private payer in particular, CMS is, but private payer in particular would pay.
So that's interesting, right? Because a lot of what we saw early on in the pandemic revolved around getting policy makers in state capitals and in Washington, D.C. on board and engaged in these discussions around reimbursement. What's the future of reimbursement for telemedicine and children's care, adolescent care? What are you seeing right now from Philadelphia, given your proximity to, certainly the capital of Pennsylvania, and then the proximity to Washington, D.C.?
Yes, so there have been major legislations in place that is pro telehealth from the federal perspective. And each state is slowly putting it into their bills and addendums to say that telehealth must be paid as equivalent to in person, and the side of care can be at home. because defining the site of care is important, where care can be provided. And unfortunately, Pennsylvania has not budged in that perspective, but other states have, such as Texas, have actually progressive telehealth bills. So what we really want is to have a solid federal bill that can that legislator advocate can use to go to each state, because it really is state dependent, and advocate for reimbursement in telehealth.
That's great. Now, one of the things that everyone looks at when it comes to these sorts of tools for kids at home are things like cerebral palsy and Downs and other populations that are affected by this and really have greater levels of intervention that are needed for optimizing things like motor skills, fine motor skills, social skills, etc. And as a part of the kind of autism care program that you guys have with Healthy Minds, Healthy Kids integrated care program, what are some of the ways in which telehealth is changing that kind of behavioral health care for those populations? And then specifically, what kind of interactions are they having with, are occurring between psychiatrists and adolescents?
Yeah, so let me define what integrated care means. So integrated care, there's a spectrum of collaboration that we are doing in primary care. So we collaborate with the pediatrician, and the goal is to the behavioral health professional, whether it is a psychiatrist or a therapist, is embedded into the primary care team in some way. And there's different level of integration. For our autism integrated care clinic, I work with the developmental pediatrician. And I see the patient, I provide consult to developmental pediatricians and help them manage the patient care. For Healthy Minds, Healthy Kids, it's a program where we go into the outpatient primary care setting. Why that is important is that we're meeting kids where they're most comfortable, right? They see their pediatrician every year at most for their well visit. Their family is more comfortable with the pediatrician. So we're catching things that are earlier in the stage. And so just the first sign of depression or the first sign of suicidal thoughts. And this is a good opportunity for me to talk about my Link to Care software, where it's a research project funded. And I am building a software platform to help the pediatrician screen for suicide risk and triages that risk into low, moderate, and high. But what do we do after that? Oftentimes parents don't know what to do if their kids have a mental health issue, right? Finding care is so difficult. So that software actually uses automation to help parents call, set up appointments, and follow the patient each step along the way until their first mental health visit. So hopefully we can build this. We actually almost finished with the software, and hopefully we can pilot it and have it be successful. And other clinics can use it as well.
Of course you do. Of course you're running software, and of course it's going to be brilliant. Not surprised at all. Truly a Renaissance woman, and very impressed. And so talk about your role as well at CHOP. Krysti, tell us a little bit more about what you're doing in terms of developing other types of telepsychiatry services. In particular for rural settings. We know that Pennsylvania is an amazing state. It's kind of a sandwich, right? It's got the two mega cities, kind of Philadelphia and Pittsburgh on the east and the west side, and then it's got a lot of rural communities and suburban communities in between. And tell us what you guys are doing to get to those populations that aren't near the super hospitals and the super specialty hospitals and the super specialists.
Yes. So we are expanding our reach, where we're using telepsychiatry into greater, more suburbia, more rural CHOP primary care sites. We have about 32 primary care sites all over Pennsylvania. In particular, right now, one of the current program we have is actually me sitting in Philadelphia, Center City, and we're actually doing consultative service to Princeton, New Jersey, with a developmental pediatrician there. And so we're expanding the reach of psychiatry and helping as many people as we can. It's not as robust as I would hope, and we're still strategizing and building the program. But hopefully we can get in more grants to help rural populations, mainly in particular because as I said, there is a fear that reimbursement may not be sustainable. So a lot of academia, a lot of hospital is looking toward grant and collaboration with nonprofit entities. We have a partnership with Girard College in developing. It's actually a high school program, despite the name, and we're doing school mental health and school telehealth into that college. But hopefully, we can do more with school collaboration.
Absolutely, yeah. That's the key, right? Is really getting into the schools and putting that together there. Well, again, Dr. Vo, thank you very much for joining us today. A virtual round of applause from all of the audience from all over the world, from obviously the U.S. to Europe to Kazakhstan. I see some folks from India. So I really appreciate your time in today, and looking forward to talking to you again soon.
Thank you so much for having me.